Now, for dental implant procedures,
Yes.
Most of these people are sedated, or all of them are sedated.
Yeah, a
And
very
you
large
like it.
majority.
I mean, you're
yeah.
big on sedation.
Well, I'm big on sedation for a couple of reasons. One, because I used to have a fear of the dentist myself.
Okay.
And so I used to be sedated for my procedures. And most people, when they come in and they think of something invasive, like an extraction or a dental implant, it's a little fearful to think about it, right? It's a very quick procedure. You can be awake for it. I highly recommend you go to sleep.
Okay.
When you start talking about what you can do, though, there's a full range of different types of sedation that can be done.
Okay.
Anything from nitrous to a pill that you can take to IV sedation to even as much as general sedation, like hospital sedation. So there's this whole host of sedations that can be done in between.
It's safe?
Very safe. So one of the things that I do in my office that I find differentiates me is I do the procedure. I'm the doctor that's actually working on your mouth, on your teeth, on your implants, on your surgery.
Okay.
I have a separate doctor, not a nurse anesthetist. This is a dental anesthesiologist. It's a subspecialty. He's gone through extensive training. A dentist that actually went to dental school and then went on and did an anesthesiology residency as well. And so he's very, very well versed.
So he pays attention to the vitals while you're doing the surgery.
He keeps an eye on the vitals. He makes sure you're asleep. And he'll be putting in different medications in your IV to make sure that nothing hurts afterwards, post-operatively. So my patients will come back the next day, the next week, the next month with minimal to almost zero swelling. Almost every single time they'll come and see me the next day for a post-op appointment, and I'll say, scale of 1 to 10, what's your pain? And I've never had somebody say higher than a 2. It's usually a 0 or a 1.
What about the next day? Can they do over-the-counter remedies?
They can.
For their pain?
Yeah, so that's usually what they do. I don't usually have to prescribe hard narcotics for this. It's typically just Advil, Tylenol, if that. Oftentimes they come to me and they say, Doc, it's 24 hours later, you put 12 implants in my face and no pain at all.
Now, for these big implant cases where you're doing upper and lower teeth, can they, because if you're over 70, and you said your average patients are in their 70s oftentimes, they're on like 4 medications statistically. Can you be on medications and still do this?
You can, yeah.
Like diabetes medications?
Absolutely.
What about osteoporosis meds?
Just about every kind of medication you can think of. Now, there's some medications that we have to take some precautions on. We'll have to stop you for a few days. Blood thinners, for example, will stop you a few days prior to the procedure, and then you start the next day.
And you may have to get with their medical doctor?
Yeah, we'll call the cardiologist and talk to them and work through that. Absolutely.